Hi there, welcome to Relentlessly Keeping You Safe. And we have as our guest today, Dr. Annette Lopez. She's a pulmonologist with Banner Health. Dr. Lopez, thank you so much for being here.
Thank you so much for inviting me.
Well, we wanted to invite you because of the topic today. We're talking about pediatric patients with asthma and during this COVID time. So let's just talk generally about do asthmatic pediatric patients, what sort of symptoms would they show, and do the symptoms, are they exacerbated with COVID, I guess is the main question.
Absolutely. So there could definitely be a relationship between children with asthma or having asthma and COVID-19 and what symptoms to look for. So asthma is the most common chronic medical condition in children. Some children have very mild asthma, whereas others have more severe asthma. And respiratory viruses are actually one of the most, if not the most common asthma triggers. So COVID-19 or coronavirus being a respiratory virus, we would expect to see children with asthma having severe exacerbations. But the good news is that we're just not seeing that. For whatever reason, which we're still learning new things about this every single day, but it does not seem to be affecting children, even children with asthma, the way that it's affecting the adult population. Children with COVID-19 may have more mild symptoms or may even be asymptomatic. Mild symptoms to look out for, which would be fever, stuffy nose, runny nose, cough that may last for a week or two, very similar to a common cold. But just because the majority of children have more mild symptoms, there's still a possibility that your child may have more severe symptoms. So severe symptoms to look out for would be a persistent fever, worsening cough, shortness of breath, any trouble with their breathing. That would be a reason to reach out to their healthcare provider or, of course, to seek emergency medical services.
What about, doctor, precautions that parents can take, especially during this pandemic time, for their children who suffer from asthma?
So that's a great question. So prevention is definitely key. So the virus is primarily spread through respiratory droplets. So if a person who's infected coughs or sneezes and those droplets land on a surface that your child then touches, children then like to touch their face, which can potentially cause the virus an opportunity to enter the body and to cause infection. So staying home is a big precaution to take. Limiting outdoor activities or limiting trips outside of the home, trying to leave your children at home whenever possible. Hand washing is important. So hand washing for at least 20 seconds. Wearing a mask for you and your child whenever you're out in public. Children over the age of 2 and up should be wearing a mask at all times. Having asthma is not a contraindication to wearing a mask, and wearing a mask cannot cause an asthma exacerbation or asthma attack. And specifically for children with asthma, it's important to follow their asthma action plan.
All great things to remember, Dr. Lopez. Thank you so much for joining us.
Thank you so much.
And we'll see you next time on Relentlessly Keeping You Safe.